The following program is intended to educate the public on a variety of cosmetic procedures and is sponsored by Sonia Cosmeceuticals and Advanced Medical Grade Skincare.
Welcome to Health and Beauty with Dr. Sonia Bansal. I'm Sharon Coleman. With me, of course, is Dr. Sonia, and today we're talking about completely non-invasive body contouring with zero downtime. Is this possible?
It is possible. It is actually a very, very popular procedure. There are ways to actually do it during your lunchtime with no downtime, and you get instant results. So,
I like that. Yeah. Lunchtime.
Yeah.
Get your nails done or body contouring.
There you go.
I think I pick body contouring. So I really want to see how it works, and I know you brought some before and afters.
I did. I would love to share those with you.
Like
yes.
see it.
I'll go ahead and... This first photograph is of a female patient. You can see her upper thigh area, which is a really tough area for women to lose. And you can see basically she's got some dimpling in there, some cellulite, those cottage cheese thighs that we all dread, and no matter what we do, we can't quite seem to get rid of it.
Right.
She had a nice body contouring, body slimming procedure done. You can really see the nice after effects. Very smooth, more contoured. You don't see the dimpling effect.
Absolutely remarkable.
No more cottage cheese thighs.
And you can tell, you know, she's fit. To begin with, she just has an issue.
Just that one little area.
And look how she responded.
Absolutely. The next patient is also of another problematic area, the buttock area as well as the upper thigh area. You can see again that dimpling effect, that shadowing effect, the cottage cheese thighs. Yeah. She had a series of treatments, and I mean fantastic body slimming, body contouring, and she's doing everything that she possibly can to lose weight, to help with her cellulite, but nothing
is working.
Nothing is working. And an interesting statistic, women over 20 years old, 80% of women have this cellulite, which is a tough problem. So unfortunately, we fall into that category. But there are things that we can do about it. So there are definitely options for us. In the next photograph, we can also see another very common area for women, which is the abdomen area, especially after pregnancies. No matter how many crunches you do, no matter what exercising you do, toning, firming, it's just tough.
After baby belly.
And so you can see the body slimming procedure that she had gotten done was after 4 treatments, and automatically you're starting to see some of that contouring, more tightening and toning, textures improved. And the nice thing is that it continues to improve as she does more and more treatments. So after 8 treatments, she had a really nice result.
And after the 8 treatments, I mean, it looks nothing like when she first came into your practice.
Yeah, so she was ecstatic.
Very, very successful.
This next patient has, again, another just one little problem area, and you can see how really, you know, tight and toned she is, and she's doing everything
terrific
in her lifestyle to manage her weight, but just that one little problematic area, and she had the body contouring, slimming procedure done, a series of treatments, and you can just see it seems to match more proportionately the rest of her body.
And you know, it kind of reminds me of Photoshop. I mean, I'm just looking at that thinking this is perfect, but it's your own personal
It's an actual patient that got it done and had fabulous results.
During the lunch hour.
During the lunchtime procedure, exactly. And the next photograph, we can also see this is a procedure for men, not just for women. Same problematic areas, the abdomen area, again, no matter how many crunches or flexing, you know, aerobic activity that they do, they can't quite seem to lose it. So nice body slimming procedure, a series of treatments, and you can just see more slim. Probably lost a couple of pant sizes there and just feels and looks great, confident.
He looks fantastic.
And this next patient here is a younger patient who, again, has just this targeted area that she wants to lose. She wants to be a little more proportionate. I mean, she's in great shape everywhere else, and you can see, I mean, look at the curves now. You can really see that she's
really
toned.
Sculpted, too.
Exactly, and all within her lunchtime. So a series of treatments, and very satisfied with her results. And finally, in our couple more patients here, a male patient who's got another problematic area, the abdomen area. Not a whole lot, but just can't seem to lose it, and had the procedure done, and just more proportionate, more slim, more toned. And then finally, another patient here, and you can see that just lost all of
results.
it. I mean, wonderful. These patients are very satisfied. They're just more confident.
Yeah, oh, of course.
And you can see that.
Well, anytime you're able to actually pull your pants up, you know, without the resistance, you're going to have certainly a lot more confidence with
Absolutely.
it. How many dress sizes or pant sizes would you say that you could actually lose with a treatment like
I
this?
think the average, I would say, probably 2 dress sizes for a woman, maybe 2 pant sizes for a male. And in clinical studies, they actually showed that patients lost anywhere from 1 to 3 inches.
This is amazing.
Yeah, and all during your lunchtime. So there's no side effects with, having stitches or scars or redness. Or you do have a little bit of redness maybe after the procedure, which is very temporary, but no garments that need to be worn. So unlike minimally invasive procedures or more invasive procedures where there is downtime, maybe a couple of days to 2-3 weeks, you're right back to work as soon as you leave our office.
So I'm wondering also, it sounds to me that this would be a great type of treatment for someone that maybe wants to get their toes in the water. They don't want to take the big leap and get into even minimally invasive procedures.
This is perfect procedure for patients who have a busy, active lifestyle. Someone just like us.
Sure.
We need to be back to work right away. We don't have that time to spare, not even maybe a weekend to spare. And so these are great procedures that have no downtime, where they can just go back to doing their normal activities. And people are busy these days, especially with the economy. They've got to go back to work. They're busy individuals, so it's great to have options for them.
Absolutely. Now, I know that I've heard of some of these treatments before, and I think that perhaps some of these treatments might also be offered at spas. Now, how does it differ when you have the treatment done, let's say, at your practice as opposed to like a med spa?
I think that there are several great places out there. However, regulations haven't quite caught up with our industry just yet. Unfortunately, I've seen a lot of patients that come to my office who've had just been disappointed with the results. Maybe it wasn't done correctly, or they weren't the right patient selected for the procedure, or worse yet, they've had complications that have been more permanent, maybe scarring. And by then, I can't help them, unfortunately. So the nice thing is that we're able to give them very real advice that fits them. Patient selection is very important. I think that
you're actually able to hold their hand and guide them through what is right for them.
Absolutely. And beauty is it's not a strict science. It is an art. So
they need to go to the right artist.
The right person.
Let's
exactly.
Say. Now, I'm looking forward to our next segment, because we're actually going to get a chance to take a look at a Vela-shaped treatment. And we'll also get a chance to meet one of Dr. Sonia's patients. So stick around for more Health and Beauty with Dr. Sonia. If you have any questions for Dr. Sonia, please visit EliteMDSpa.com. Click on the link for Health and Beauty with Dr. Sonia. We just may answer one of your questions on our upcoming segments.